Hello, and welcome to Healthcare IT Today, where we explore the latest healthcare technology trends and discover valuable insights in health IT. I'm Colin Hong, and today we're going to talk about patient experience and consumer experience. Sitting down with me today is Jason Wells, Chief Strategy Officer at Adventist Health. Jason, welcome to the program.
Good to be here, Colin.
Also joining me today is Michael O'Neill, Founder and Chief Executive Officer at GetWell Network. Michael, welcome back to the program.
Thank you. Thank you for having me.
Hey, I'm really looking forward to learning from both of you today. But maybe let's start by establishing a baseline for everyone who's listening and watching. Over the past several years, I think we've seen a lot of effort and focus from healthcare on creating better consumer experiences. What does that term mean to you, and why has it become such a focus? Jason, let's start with you.
Great question. I said that the shift is probably, think of the old days of healthcare where we did things to patients. We're the experts. We know everything. Just sit tight and we'll take care of you, and we're going to save you and send you on your way. I think consumers have different expectations. And so certainly through the pandemic, it's accelerated all of our consumer strategies, everything that can be, done through this device. And so consumers are used to things being, you can buy a Ford F-150 and have it show up at your house. Tesla taught us that you don't have to go haggle over a car. It will come to you. So we've got to figure out how to do healthcare everywhere. It's what consumers are looking for. And so that's the shift where the days hopefully are gone where you book an 11 a.m. clinic appointment and you're still sitting there at noon and haven't gone back. And you haven't walked out and said, I'm never coming back, because consumers finally realize they have power. They've done it in other industries, and the industries that are thriving or surviving or thriving are the ones that put the consumer's needs first and organize around what they're asking for. So yeah, I do think it's shifted from patient experience to true consumer experience, and they're more empowered, they're better informed, and they're expecting a higher level of service.
So, Jason, I can see how this is a good thing for patients, but this consumer focus, is it a good thing for you as a healthcare organization as well?
Absolutely. I think that those of us that can be the top consumer-oriented organizations are going to win the trust and support and the lifetime relationships with people who are empowered to make better decisions about who they should partner with for their healthcare.
And Michael, what's your thoughts on this?
So the difference to me, actually, I think it goes with both the evolution of how health systems and providers deliver care. It actually speaks to the evolving business models, and it also speaks to the evolution of GetWell. And I think that, for years, health systems and GetWell and the payment systems were set up to simply take care of sick people, and those were patients. And I think that all these things are evolving along with technology to whereby it's not necessarily taking care of a sick person, but actually how might you wrap your digital, virtual, or physical arms around people in your community to really help them kind of navigate, their life journeys through the lens of their health, not necessarily their sickness. And I think while I know it can be confusing, it actually feels pretty appropriate and natural that it's evolving kind of over time.
Now, here's something I've been worried about. Before the pandemic, I really felt that there was a momentum towards improving the patient experience. But then the pandemic hit, and healthcare organizations obviously had to focus on taking care of patients as well as keeping their staff safe. Do you think that patient experience will become a priority again, back to the front burner, so to speak? Or do you think it's had its moment in the sun?
No. We will jump a decade ahead because of the pandemic. I think that we did take a step back. There is no question, Colin, that when you deny visitors access to their loved one and people are passing in the thousands without family network around them and saying goodbye over iPads and just the type of stuff that we were forced to do because of this pandemic, heartbreaking. It was heartbreaking for our staff to have to be both the caregiver and the family member at the same time. And just rules, the no visiting, that is probably the biggest one that just was so against our DNA as an organization, that family is a part of this journey and you will never be alone. And we ask so much of our staff. So I do believe that we are going to come out of this. We are already coming out of this much more consumer focused. Patients, consumers are asking for things that we must provide, and they will gravitate to the health systems that provide those.
I guess I would tell you that from our interactions with our partners across the US and even across the world, I think that we're probably closer to quote unquote getting back there than you may think. But I'm not sure it's getting back there. It actually is getting to the next phase of this work. And so, of course, what we're all focused on, and rightfully so, is look, the toll that this has taken on our workforce in healthcare, of course, is impossible to overstate. And so there's attention, and rightfully so, on how we actually create experiences, care environments, kind of tools, processes, people, technology to make sure that we actually stand these incredible healthcare workers up, and provide them resilience, not just through our encouragement, but actually through the way that we're helping them do their work in a more effective, efficient, and energy-inducing way. But part of the answer to that challenge is to get consumer experience and patient experience right. Because as we all know, a more active, involved, engaged patient is a better patient. And the care that has to be delivered to that patient actually gets better, and it's more resilient for our staffs and more efficient if these patients are activated in the right way. So again, I think we think about these things as so separate, all the time. And I actually believe one thing the pandemic taught us is like, only when you figure out these unexpected collaborations and how they actually work together can we really, truly have the quote unquote transformation that all of us have been pushing on for so long in the industry. And I think there's a real opening for that right now, candidly.
Michael, where are you seeing your clients invest in patient experience? Is there a specific area that you're seeing some movement in?
Yeah, so I guess I'd say three things on this. The first is what has not slowed is strategically, at the largest, most complicated, and most successful organizations, at the executive level, from the CEO to the chief strategy officer, chief digital officer, the chief clinical folks, or whatever the case may be, there is real strategic thinking and investment going on around consumer experience and navigation, like real at the highest levels. How do we think about this from an enterprise level? How do we figure out what consumer experience navigation means? What are the platforms and tools and partners we need to actually help us accelerate? That's one thing. Now, that's at the high level. At the ground level, there's real tactical investment going on, probably not surprisingly, on things like patient outreach, retention, and loyalty. How do we how do we take our digital arms, reach them out to the community, pull these dormant patients or patients we haven't seen in a year and a half because they've been afraid to come in or whatever, or they've missed their normal vaccines because they're taking this COVID vaccine or whatever the things are. So we've seen a lot of investment in, hey, help us get back in front of the consumers who have been scattered in panic for 18 to 24 months, and help us allow us to be the trusted resource to help them kind of come back into their health journey in a proactive, positive, well-being way. So we're seeing a bunch of investment there, number one. Number two, we are seeing a bunch of investment in how to rethink. People used to talk about smart patient rooms, and we think about these things as smart patient spaces because it's not always the room now. Sometimes they're in a room, sometimes they're in a hallway, sometimes they're in an ED or an urgent care center or back in their car. And so we are seeing a lot of investment in helping to create smart patient spaces where we actually can have more effective and efficient, sometimes all completely virtual, sometimes hybrid, kind of environments. And the third area we're seeing investment in is there were a lot of headlines about how the pandemic impacted both our healthcare workforce and also our underserved populations at disproportionately terrible ways. And we are seeing some really sustained investment on doubling down on, hey, how do we figure out how to leverage technology and digital tools to reach out to historically underserved populations and communities and make sure that they're getting some of this amazing care that the rest of us are getting all the time by giving them better access, using digital, being more effective and more personalized in doing that. So we're seeing some really interesting things, I guess, in those three areas.
Michael, it warms my heart to hear that there's real investment being made in addressing health equity, one of my favorite topics to talk about lately. The pandemic really showed us the stark differences in how healthcare really isn't evenly distributed across the population. Jason, are you looking at this underserved population at Adventist?
Absolutely. A lot of our footprint with Adventist Health is in the most underserved parts of California. And so we saw it firsthand. And we have all rallied around the idea that we must do better. And, when you see groups of people that are horrifically underserved through a pandemic, there is a new, moral imperative that this will never happen again. And so finding partners like GetWell Network, who are on the forefront of pushing us to be better and connecting with all patients. And so, with our partnership with GetWell, very excited about what we're doing over GetWell Anywhere on the phone, English and in Spanish, and pushing to even more languages. But how do we come to work each and every day, making sure that we're not leaving anyone behind, especially in the underserved areas of California where our footprint is, that they have access to the same care. And it's through a lot of the nudges and the digital communication. That partnership, we are reactivating patients that we haven't connected with in years. And so they're getting text messages on their phone, click here to schedule an appointment. And we are proactively reaching out as opposed to being a reactive healthcare organization and just transactionally connecting with consumers when they come to us, and then we send them on their way. So much more proactive, moving to relationships from transactions.
Michael, I see you put your hand up. Do you have an example you wanted to share as well?
Completely. It's amazing. We're working on a program with Common Spirit out west, and it's in a population of mothers on Medicaid, and we are using a combination of kind of AI driven kind of consumer outreach via SMS with like these local but virtual navigators who live in these communities. They know where the local supermarkets are. They understand where the physician's office is and that kind of thing. And so we are seeing an amazing commitment by organizations like Common Spirit to figure out how to deliver better care, in these communities. And secondly, we are seeing like the efficacy and the engagement rates of our Latino moms, our African-American moms match all of the other communities that we're actually serving. And so we're just seeing some real promise when you do this with thoughtfulness and with the right kind of partnerships. We're just seeing some fantastic outcomes and really exciting kind of work.
Jason, what other areas are you investing to improve in the patient and consumer experience?
Yeah, I would say in the middle of the pandemic, we've come a long way. We have a long way to go. A journey of 1,000 miles, that is a single step. So we're 10 steps in, I would say. But we do have online scheduling finally lit up across all of our 300 primary care providers. And so we can send a text message out, you can tap on, and Kyruus is our partner on that, and that has gone well. Looking to move into specialty, looking to move into imaging, and as many things as possible, putting right in the fingertips of consumers. So our digital front door was probably a little mouse door. It's a doggy door. It's not the big, huge garage door that I would like it to be. So we're headed that way. So different conversations with different partners are coming along well, that we want to be just the easy choice and remove all the friction, the uncertainty, and the complexity that is healthcare today. And so happy where we're headed, not happy that we're not as far as I'd like us to be.
Jason, I have to ask this. What's the reaction been from staff to all of these new changes and new technologies like online scheduling and proactive reaching out to patients? Has it been positive, negative? What's going on there?
I would say 80% positive. You still have the people with a patient experience mindset that aren't really ready for a consumer experience mindset. And there's a small subset of people, well, this is the way we've always done it. And patients revolve around our schedule, not the other way around. And so it's that change management, it's that navigation, but 80% are like, I've been wanting these tools myself as a patient. I have them with DoorDash. I have them with Amazon. I have them with Uber and Grubhub. Why, Starbucks, my coffee's waiting for me. I pick it up and keep going, or it comes to me. Why don't I have these in healthcare? So most everyone gets it. We're going to get everybody there.
Love it. Wow. Jason, let's keep going with you on this thread. What are some of the investments that you'll be making over the next 12 months around patient engagement and patient experience?
Yeah, we know we need a Salesforce like as probably one of the leading platforms in the industry. We know we need a platform on which to build. Right now we've cobbled together. When you look at our portfolio of partners, I'd say there's probably 15 different companies. It would be great if there was one that could do it all. And so, we've made the investment with VisitPay and R1 into the consumer financial journey. And so the ability to leverage their Tonic relationship to come in and have a complete intake experience on your phone, signing your pre-auths, taking a photo of your insurance card, your driver's license. And so you can walk into a clinic and not take the dirty clipboard and look at the piece of papers that are photocopied a little bit crooked. You can barely read everything. And I filled this out yesterday at the clinic down the street. Why am I doing this again? Kind of stuff. So, going to a paperless digital intake experience, great billing experience, that's a big investment we've made. We'll light that up. And at the end, I think third quarter, we're on track for. So that's a big one. But again, it's a team that's connecting for a part of the consumer journey. We long for one partner that takes us from, online, interested who we are, chat bot, start that communication all the way through the intake process, the experience process, the discharge process, and then the managing for well-being for the rest of their life. Right now I've got so many different voices and trying to make sure we're talking with the same tone, the same 5-digit code. I mean, you get all the things that the opportunity is huge to have one partner. And if someone steps up in that space, they're going to do very well.
Jason, final question for you. What message would you like to send to your peers at other healthcare organizations who maybe aren't thinking about consumer or patient experience?
I think that I can't imagine there is one, Colin, doing that, but because we got a lot of smart people in healthcare, and with the disruptors that are coming from the Amazons and Forwards and all the other entities out there with billions and billions of dollars of cash to throw at this in R&D. We have to be better. We do have that trusted expertise, that deep relationship, the history of being in this space. Healthcare can't just be consumer. There is a depth and an expertise and a trust that's earned. And so we need to leverage who we've been and who we will continue to be. And we won't exist if we don't better compete with everyone who wants to come in and take the cream off the top. And then we're left as safety net providers. We're already 84% government payer in Adventist Health. So, we don't have the payer mix that pays the bills like some other health systems, but it fits our mission to not leave anyone behind. So we will continue to lean into that space and do it in a way that is consumer focused. So they have the same rights as people living in San Francisco and LA and some of the big cities in California, because they deserve that same access to care with the same high touch and high tech that we believe this move. So yeah, I would just challenge everyone. The time has long come that we must be consumer focused organizations, and caring for the gallbladder in room 62, those days are gone. We are caring for family, and we need to do it in the same way that other industries are doing it. Healthcare cannot be the aircraft carrier that is so slow to turn, or we will be passed by and we will not be a relevant industry anymore.
Gentlemen, it's clear that both of you are very passionate about patient experience. You both shared some fantastic stories and perspectives with me today. Thank you both for being on the program.
Hey, thanks for having me, and appreciate what you guys are doing to get the word out about great patient care, great consumer care, and everything you're doing in IT. It's awesome.
It's such a pleasure to speak with you always, Colin, man. Thanks for doing what you do.
That's so nice of you to say, Michael. Totally appreciate it. Hey, and that wraps up another episode. If you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give us a review on iTunes, Spotify, YouTube, or wherever you're watching or listening. Also, head on over to healthcareitttoday.com, where you can access free resources, industry news, and insightful articles. You can also connect with us on Twitter using the hashtag HITSM. I'm Colin Hung. Thanks for being here.